This lesson will cover Chapter 2, Key Issue 3, Why Do Some Places Face Health Challenges? We're going to be looking at health and gender, health and aging, medical services, and the epidemiologic transition. First, let's take on health and gender. We know that cultural and economic factors put women at risk in some countries versus others. The less equity there is between men and women, the more at risk women will be. This inequity can be reflected in the preference of boys versus girls when it comes to bearing children. The inequity is also reflected in the health services that may not be readily available to women. There are more males than expected in some countries, and to understand that, we need to look at the sex ratio. Sex ratio is determined by number of males over 100 females. The average world ratio is 105 males per 100 females. When we compare that to the sex ratio of countries like China or India, we notice a major difference. The sex ratio in both China and India is 112 males to every 100 females. The percentage of newborn females in the world's two most populated countries is much too low to be random. The extremely low percentage of female babies is the result of cultural preference on part of having sons rather than daughters. That being coupled with government policies in these two countries to encourage people to have fewer children is also contributing to this ratio. The United Nations has suggested that although these policies have helped to try and reduce overpopulation, that a more effective way is getting to the root of the cause in sex selection, which is gender inequality. We are also finding that another result of these kinds of policies is that these countries now have more males who find it hard to find a female to marry. We're also going to spend some time looking at pregnancy and childbirth being much riskier in some parts of the world versus others. Part of that is connected to the maternal mortality rate, and that is looking at the number of pregnancy-related female deaths per 100,000 live births. Let's take a look at the sex ratio at birth in Figure 2-19, located on page 58 of your textbook. The lavender colors on this map will represent what we would expect from standard biology, meaning that the average world sex ratio is 105 males to 100 females. Again, the lavender colors are going to demonstrate that. The more green regions are going to indicate a preference for boys, meaning that you're going to have much higher numbers of males to females. This can both be reasons of cultural preference as well as implemented policy. The regions that have the darkest green are ones that you are going to see aggressive policy. Here are two maps further dissecting China and India. What you'll see here is that both countries have higher than expected sex ratios at birth, but if you look at the different regions of the countries, you'll find that some areas have even higher ratios of males per females than others. Now let's look at another health concern, the maternal mortality rate. This map is Figure 2-21, and it's located on page 59 of your textbook. The maternal mortality rate indicates the number of women who die while giving birth per 100,000 live births. You will notice that the rate exceeds 100 deaths per 100,000 mothers in much of Africa and Asia, compared to fewer than 10 in most European countries. According to the UN, the most common cause of maternal death in poor countries is obstetrical hemorrhage. This means death by excessive bleeding. Developed countries, on the other hand, have medical facilities, advanced technologies, and trained personnel that help limit the incidence of these life-threatening conditions during childbirth. It is important to note that the maternal mortality rate in the United States is a lot higher than that of other developed countries. The higher rate is due to the fact that low-income people have a hard time gaining access to health care. Next, we're going to get into health and aging. Population pyramids display age and sex structures. This helps us gain a better understanding of the demographic transition. Looking at these structures, we may have a better understanding of the dependency ratio. In order to calculate the dependency ratio, we look at the number of non-working age people over the number of people who can work. So individuals that are considered working age are between the ages of 15 and 65. Non-working age people are either younger than 15 or older than 65. If a country is in stage 2, they're going to have a lot of people under the age of 15. If they're in stage 4, they're going to have a lot of people that are older than 65. And then we are going to look at the infant mortality rate, or the IMR. In this case, we're looking at babies that die between the time they're born to their first year of age per 1,000 live births. Knowing how to read population pyramids will give you a better understanding of where a country may be at in the demographic transition. The pyramid will show sex structure comparing men to women or males to females. And it will also indicate the age groups that they fit into, as well as the percentage of the total population that age group makes up. Take a look at the Gambia. This country is in stage 2 of the demographic transition. You can tell this because the pyramid has a much broader base than that of countries that are considered stage 4, like the US or Denmark. Then taking a look at Mexico in population pyramid C, you'll notice that that pyramid is in stage 3. This is because birth rates have started to decline, but the level of development has not been experienced for long enough to have reached stage 4 yet. Both Denmark and the United States have experienced declining birth rates for quite some time. This next map, figure 2-23, can be found on page 60 of your textbook. It addresses the percent of persons under the age of 15. Remember that this contributes to the dependency ratio. Stage 2 countries are going to have a much larger percentage of their population be in age groups below 15. The large percentage of children in sub-Saharan Africa that you see here does strain the ability of relatively poor countries to provide needed services like schools, hospitals, and daycare centers. So again, this is a reflection of the level of development that we see in certain parts of the world. So the less developed, we're going to find that a larger percentage of the population is going to be under 15. The dependency ratio might also be high in very developed countries that are in stage 4, but for a different reason. This is because they have a much larger percentage of their population that are older, above the age of 65. Figure 2-24, located on page 61 of your textbook, is going to indicate the infant mortality rate per 1,000 live births. Remember, this is the number of children that die between the time they're born and their first birthday per 1,000 live births. You will see on this map that high IMRs are common in sub-Saharan Africa, but also in Southwest Asia, as well as Southeast Asia. Lower infant mortality rates are found in countries with well-trained doctors and nurses, modern hospitals, large supplies of medicine. The IMR is 4 in European countries. Those countries tend to be in stage 4, compared with 64 in sub-Saharan Africa. To put that into perspective, that's 1 in 15 babies that die in sub-Saharan Africa and 1 in 250 that die in Europe. This graph, figure 2-25, located on page 61 of your textbook, is going to show the elderly support ratio. The smaller the number for the elderly support ratio, the fewer workers are available to support those elderly people. Currently, the world's elderly ratio is 9. That means that there are 9 people who are able to work and cover 1 elderly person. By 2050, the ratio is expected to decline to around 4. What that means is that there will only be 4 people of working age able to support elderly people who've retired from work. Ultimately, when that ratio gets smaller, there are going to be fewer people contributing to things like pensions, also known as retirement plans, healthcare, and other support that older people will need. The next thing we're going to be looking at is medical services. So this is where we're going to look at health conditions and how those vary in different parts of the world, particularly with regard to expenditures, so how much healthcare costs, looking at it from a private perspective, but also a government-funded perspective. Then we're going to be looking at medical facility availability and the hospital beds and physicians that are available in different parts of the world. First, let's take a look at how much healthcare costs per person or per capita in different countries. As you'll see, the most money that's spent per capita is in your more developed countries. The least spent per capita is going to be in your more developing countries. It is also fair to say that we see a correlation between healthcare accessibility and longer life expectancies. On a side note, healthcare exceeds $1,000 per capita in Europe, but $5,000 per capita in the United States. The irony is, although the United States spends the most per capita than any other country in the world, healthcare is still not accessible to all citizens. The high cost in the United States is in large part due to its long history of privatization, as well as the high cost of pharmaceutical medications. The United States is the only developed country in the world that still debates whether or not healthcare should be a right or a privilege. This map also coincides with that last one to some extent, looking at medical services and how much the government is spending on health expenses. So if you look at the key here, the government expenditure on health is the percentage of total government expenditures here. So 15% or higher is in your darker green regions, and that becomes lighter where there is less of a percentage that's spent on those services. This map will also reiterate that, looking at hospital beds per 10,000 people. The more hospital beds, the more developed a country is going to be. Interestingly, we see that there are more hospital beds available per 10,000 people in developed regions of Europe, for example, versus North America, including the US and Canada. This last medical services map, figure 2-29, located on page 63 of your textbook, is going to look at physicians per 10,000 people. So naturally, we can assume that the more physicians there are per 10,000 people, the more developed the region or the country will be. Again, you may find that the developing countries of Europe have a higher number of physicians per 10,000 people than the developed countries of, let's say, the United States or Canada. This is the end of the lesson on Chapter 2, Key Issue 3. There is technically another part of this key issue that I have not addressed on the epidemiologic transition, but I will connect that to the demographic transition model in a future lesson, so look out for that.